Good evening, everyone. This is Rick Richards, and you are watching COVID 25 for the evening of March 31st, 2020, and day 15, I guess, of self-imposed lockdown. Sorry there was no morning show. Unfortunately, I have a day job. I was kind of swamped this morning. Wasn't really much I could do. I did watch the press conference, the Trudeau's press conference. Wasn't that impressed, but you know what? We got a good show for you. We got a good show for you tonight because we're going to do one of the things you guys love. We are going to do the deep dives. We are doing a deep dive into China. Any of you that watch the show may remember that I have been, let's say, somewhat suspicious of the numbers and the information coming out of China. So we're going to take a deep dive into that. But first, I am going to crack a monster who's not a sponsor of the show, pop some pills from Athletic Alliance, the Advanced Nootropic. They sharpen me up, man. These things keep me going, and you need it now. You have got to have your wits about you these days. You've got to be sharp. You've got to be on the ball. There are 1,000,001 scams out there. There's opportunities if you look for them. There's challenges. There's difficulties. There's information. Always information coming in. You got to be sharp, man. Oh, man. All right. All right. Let's do this. First, we're going to do our shout outs. Our shout outs are going out to super producer Dave Darnley. Shout out to Terry McLean. Shout out to Jixer. Big shout out to Dwayne Knutson, who wanted the China deep dive. Shout out to Chad, Rick, Ivan from Sector B49, Irina, Sandy, Rhonda, Kim, Tanya, Tammy, Carol. I know Carol's watching. Friend of the show, Lisa. Always. And anybody else that's new and on board. Micro Duck Dong. Shout out to you as well. All right, so let's get into it, man. Sorry, but I'm pissed off. I am pissed off because there's a lot of things that don't make a lot of sense, right? We'll get to that, though. We'll get to that. Let's start with our basic update first. Where we are. Where are we? We are right here. Okay, so let's look at the global numbers for our pandemic. Excuse me. All right, coronavirus cases, 854,307 confirmed cases, 42,016 deaths. Over 176,000 have recovered. I wonder what classifies a recovery. I guess a lack of symptoms or lack of a temperature. I'm not quite sure on that one. Maybe next time we'll go into some of these and take a deeper dive into some statistics. All right. Here we are. Here we are. Let's do a sort. Okay. Italy, 105,000 total cases, 4,000 new cases, 12,000 total deaths, 837 new deaths. So this number right here, this is flattening out. We've heard this term, flattening the curve, and it definitely has happened, right? Or it is happening. The curve, I mean, before the curve flattens, the rate of decline, it's obviously it's not like a square, it's a curve, right? And so the rate of the acceleratory rate is leveling off. So that's what happens. This number is still going to be fairly high because there's a lag effect of all the people that have had it, right? But as a percentage of total deaths, it is definitely declining. And the absolute number, that's another important thing. The absolute number has fallen off of its peak. It peaked at around 1,000 and it's kind of leveling off. So I'm prepared to say that the curve is flattening in Italy. One thing I have observed, I haven't mentioned it with you guys, but I have been observing it. And it seems there's about a 2-week period between when the infection rate is going up its quickest to the death rate and the exponential growth. And that's about 2 weeks. And I think we're there with the US right about now. So probably this thing will peak at around 2 weeks from now and then start leveling off there as well. Spain also leveling off. 748, that's about 8% of the total deaths. UK is still in the upward trajectory. Still in the upward trajectory, although their numbers are much more manageable. Netherlands, we've been watching the Netherlands. Remember, that was one of my places to watch. Yep, still trending upwards. Still trending upwards at about 17%. So this number should be at about 2,000 in probably about 5 days. If that rate continues. What else? Turkey is another one. Austria, Portugal, Denmark. You guys think we should do a deep dive on Africa? Like normally when these viruses make their way around the world, then it's usually Africa, right, that gets smacked in the face the hardest. It's usually Africa that, they say, well, you know what, I won't say anything graphic, okay? But anyways, Africa is usually the last in line for the kicking and usually gets the worst kicking. But Africa seems to be doing pretty well. So you know what? Come on, Africans, step up. Send us some aid. Maybe we should migrate to Africa. Anyways, that's what we're looking at in the world. And once again, I will go to our friends in China. Total cases. See, China has really fallen down the list here. Okay, so still only 81,000 cases in China. No new cases. That seems strange. Total deaths, still only 3,300. But, I mean, that's equal to the U.S., although the U.S. has twice the cases. So I suppose it's possible. I suppose that death rate is possible. We'll get into the deep dive. But first, let's take a look at Canada. British Columbia, the province that is near and dear to our heart. Good. We've just gotten an update. Should I say good? I'm happy we got an update. Unhappy if the numbers, of course, have gone up. British Columbia, 1,013 confirmed cases, 24 deaths. That's taken a big jump in the last 2 days. So let's see. Let's see if there's any information on what's happened here. I mean, these guys, they post these updates, but they don't post a whole lot of insight. Quebec has had a surge in new cases. Ontario, 260 new cases. This is a little bit troubling to me because British Columbia, the number of deaths had been at 19, and it had stayed there or fairly stagnant for about 3 days in a row, which, as I mentioned, would indicate a flattening of the curve, right? But we've had a jump up to 24 deaths, which is obviously a little bit concerning. Alberta 8, Saskatchewan 2, Ontario and Quebec, quite a few there. Ontario seems to be especially deadly in Ontario. Actually, BC would be the deadliest place. I would like to get some information on the hydroxychloroquine. Holy shit! Goddamn, this name is going to kill me. Hydroxychloroquine. Shit. I'm going to record that and then just play the recording next time. Anyways, that's been tested on the patients and the staff at the Lynn Valley Care Home, which has been the hardest hit. I don't know where these new deaths have come from. It doesn't say. Maybe from that place, and it may indicate that hydroxychloroquine doesn't work, or these are people that were just too far gone and had been sort of hanging on. So there we go. We're at 100 total deaths in Canada. Roughly half of Canada's cases are the result of community transmission. I mean, that's a surprising number there. Only half are community transmission. That means more than half of what we've gotten came from people coming in outside. I mean, that just shows you that decision to close the borders, March, what the hell was it? March 15th or whatever it was way, way too late. Way too late. This easily could have been half the problem or less than it is now. All right. British Columbia, there you go. You can see we had a bit of a leveling off, and then it's come up. But you know what? I don't know. Overall, we might be able to say that this cases, let's see new cases. Okay, there we go. This is a little more promising, right? March 24th may be the peak. See, you know, everybody was shitting all over Bonnie Henry, you know, for daring to come out and say that she sees some positive signs. Well, so do I, man. So do I. It looks like the peak number of cases was March 24th, right? And this is despite the fact that testing has increased. There's more testing now than there was March 24th. Certainly more testing now than there was March 18th. So it's very likely that the peak was actually around here, the peak of infection. So if the peak of infection is March 18th, we can assume with a 2-week possibility of incubation, we could see the peak of the peak of the death rate around the beginning of April. If it's here, then that would mean maybe about the first week of April. So either way, obviously I'm no expert, but my hunch is that we are at the leveling off period, and we are going to see probably a leveling off by maybe the second week of April, the end of the first or the end of the second week of April. Probably around Easter, we're going to see a leveling off. The age range based on those ending up in hospital is between 50 and 70. It's funny because when I look at this and see elderly people affected, and then I remember I'm 50, so I'm elderly. Fuck you. Anyways, elderly people and immunocompromised people are more likely to have worse outcomes. So I guess the transmission goes society wide, but it's just more damaging if you are older and if you have a compromised immune system, underlying health problems, we call those. And as I have mentioned earlier, I was speaking to a girl that works at a grocery store, and I asked her and the rest of their staff have literally been in close contact with probably several thousand people, because as we all know, the grocery stores have gone mad, right? And not one single person, not one, has been sick and missed work. So think about that. Think about that. Okay. Let me take another hit. Tight. Oh, that's tight. All right. Now, I'm going to drop some factoids on you guys. Do I need to do air quotes? Or is that kind of stupid, right? I'm going to drop some factoids on you guys. You guys remember Arsenio Hall? Who's old enough to remember Arsenio Hall back in the early 90s? Do you remember he had a segment called Things That Make You Go, Things that make you go, All right, so I have a few things that are going to make you go, And here is the first one. Did you know there is a Wuhan Institute of Virology? The Wuhan Institute of Virology is a research institute on virology virology means viruses, administered by the Chinese Academy of Sciences, located in Zhengjia District, Wuhan, Hubei. It opened mainland China's first biosafety level 4 laboratory. What's a biosafety level laboratory for? Is a set of biocontainment precautions required to isolate dangerous biological agents in an enclosed laboratory facility. The levels of containment range from the lowest biosafety level to the highest level, from 1 to 4. And this is the highest level. So, what have we here? What have we here? We have the only level 4 biosafety lab in China. And again, what's level 4? What does level 4 indicate? Level 4 is the range, the highest end of the range of biosafety. These are containment precautions, right? So, interesting, huh? Isn't that interesting? And it just happens to be where this virus broke out. Like, what are the odds? What are the odds? A laboratory. Okay, a microbiology laboratory under the Chinese Academy of Sciences. Huh. Guess what? Another coincidence. Another coincidence. They were doing coronavirus research. So in 2005, a group including researchers from the Wuhan, we've heard of Wuhan, right? Institute of Virology published research into the origin of the SARS coronavirus, finding that China's horseshoe bats are natural reservoirs of SARS-like coronaviruses. Continuing this work over a period of years, researchers from the institute sampled thousands of horseshoe bats in locations across China, isolating over 300 bat coronavirus sequences. All right, okay, man, okay. So first of all, let's deal with the wet markets, right? Okay, so for 15 years, this lab, this institute, this government highest safety level government, or highest authorized level government lab, is doing research into viruses found in bats. Okay, they're researching viruses that are found in bats. And they isolated over 300 bat coronaviruses. They've sequenced them, right? So if you have a government, like China's a dictatorship, okay? Let's all be clear about that. If they want to do something over there, they do it. If they want to stop something, they stop it, right? So for 15 years, you've had a lab in Wuhan, right? Sequencing coronaviruses in bats, sequencing 300. So why would you let people eat bats? If you have a government facility in a city where they're serving bats, bat fucking soup, right? Hey, can I get a bowl of soup? Oh, and do you mind if I have a dead bat in there as well? Okay, whatever, man. You do you. But I mean, they've isolated 300 coronavirus sequences in these bats, and they're still letting people eat them? Like, holy shit, I don't even really know where to go with this. Like, either they're criminally negligent by letting this practice continue, or there's something else going on. In 2015, the Institute published successful research on whether a bat coronavirus could be made to infect HeLa. What's HeLa? HeLa is an immortal cell line used in scientific research. It is the oldest and most commonly used human cell line. The line was derived from cervical cancer cells taken on February 8th, 1951, blah, 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 from a patient who died of cancer. Okay, so that's essentially, it's like an entry point, right? A team from the Institute engineered a hybrid virus. What's a hybrid virus? It's defined by the Center for Veterinary Biologics as a new hybrid microorganism created by joining nucleic acid fragments from 2 or more different microorganisms, in which each of at least 2 of the fragments contain essential genes necessary for replication. Okay, so they engineered a hybrid virus that can replicate, right? combining a bat coronavirus with SARS, a virus that had been adapted to grow in mice and mimic human disease. The hybrid mimic human disease. Okay. So look, man, I mean, if you're looking at this and you're not thinking to yourself, all right, I think we get the picture here now, right? I think this is pretty clear. I don't know if this video is going to be censored, but I think this is pretty clear, right? So in the place where this global pandemic started, there just happens to be a government biological lab that specializes in creating viruses and studying viruses. Okay. And 5 years ago, they engineered a hybrid virus combining bat coronavirus with SARS. And they adapted it to grow in mice and mimic human disease. The hybrid virus was able to infect human cells. Okay. I think that says quite a bit, right? I think it says quite a bit. So during January and February 2020, the Institute was subject to further conspiracy theories. There we go with that term again, conspiracy theories. Like, excuse me, but what the fuck is a conspiracy here? I mean, this is laid out pretty clearly, right? This is laid out pretty clearly. And okay, maybe they didn't deliberately, spread this, but it's quite possible. Isn't it quite possible that it escaped from there? And if it didn't escape or release or whatever from this lab, why are you letting people eat bats, for fuck's sakes? You know, you found 300 sequences of coronaviruses in bats, and you see somebody eating bat soup, and you're like, that's a shame. No, not good enough, man. As the virus spread worldwide, the Institute continued its investigation. The New York Times reported Xi Jinping at the Institute were first to identify, analyze, and name the genetic sequence of the novel coronavirus and upload it to a public database for scientists around the world to understand. Anyways, all right, let's get off that. Okay, so, all right, so let's examine where we are. Now, you got to remember, when we're piecing together things like this, you and I and most of the world, for that matter, we really don't know what's going on, right? How could we? We know what's going on in our own environment, and that's really the extent. Anything beyond that, and we're going on our own, you have guesses, which are a shot in the dark, and then speculation, which is a little more of an educated guess, right? But we're dependent on other people for information, of course. So what it's like going into a giant room, a giant funhouse that's dark, and every now and then the strobe light flashes on. And when you get that little flash of light, you have to pick out what you can pick out, and you have to compile as much information as you can from that little flash of light, right? And we're getting little flashes of light. So let's see what else we got here. So okay, so here's something else that's interesting. Back in November 15th, 2019, Texas, the Texas government, the public health advisor, was posting jobs for a quarantine program, asking people to apply then. Again, that seems a little strange. This was the CDC, CDC, Center for Disease Control. Why were they running ads for quarantine? Multiple states, not just one. That's kind of interesting, right? Okay. The WHO ignored Taiwan's warnings about coronavirus in December. Okay. So, I mean, we see, this is why everybody is so confused. Do you get the feeling on this virus that you're either completely overreacting or completely underreacting? And that's because we get so much conflicting information and so much contrary responses, right? So now we got governments everywhere threatening to arrest you if 4 of you get together in a fucking park somewhere, right? But back in December, the World Health Organization. So this is an international organization paid for by your tax dollars. All the member countries pay the taxes to set these things up and keep them going. They were warned by Taiwan about the coronavirus in December. Taiwan warned about human-to-human transmission of coronavirus on December 31st. That would have been a good time to take that seriously, right? That would have been a good time to maybe, shut down traffic, tourism, immigration, or whatever coming from these parts of the world. And that would have been a good time to kind of take a deeper look and find out if this was something to be concerned about, right? Probably would have cost a few $1,000s, send a few experts in, take a better look. I mean, it certainly would have been preferable to pausing the entire goddamn economy. But hey, so back in December, Taiwan's Ministry of Foreign Affairs on Tuesday, March 24th, confirmed that it had warned the World Health Organization about the human-to-human transmission of the Wuhan coronavirus in December of last year. Chinese Ministry of Foreign Affairs spokesman Hu Chenying posted a tweet on Saturday claiming that the Wuhan Municipal Health Commission had issued a notice about the COVID-19 outbreak on December 31st. However, in reality, the notice stated it had not found any human-to-human transmission. Oh, thank you. Good job, guys. In response to Hua's tweet, the U.S. Department of State spokesman Morgan Ortagus on Tuesday, March 24th, pointed out that Taiwan had tried to warn the WHO about human-to-human transmission on the same day as China's statement. She then pointed out that China tried to cover this up. China tried to cover something up. And with the Wuhan Public Security Bureau issuing a summons to whistleblower Dr. Li Wenliang for spreading rumors. So, okay, so there's a doctor in Wuhan, and many of you may have heard of this guy already, and I believe he's dead now. He was a whistleblower, and he tried to say, look, this is way bigger than you think. This is way more dangerous. It spreads human to human. And he was arrested for spreading rumors. See, that's when, anytime there's, you really have to be careful about the government and about these corporations trying to silence people for what they call fake news. Sure, there's fake news out there, but who's to decide, right? And you know what? It's easy to label something. Like, it's evil to label somebody a dissident, and then, who knows what happens to them, right? Okay, so that was December 31st. Taiwan had issued this warning. Okay, now this is also something a little bit shocking. So the Wuhan COVID-19 death toll may be in the tens of thousands. Data on cremations and shipments of urns suggest. All right, so you guys may remember from an earlier show. I was looking into the cell phone records, cell phone accounts of something like 21 million people in China had vanished. And they had not, and I mean, there could be explanations for that, right? There could be a deal going. There could be, maybe the government shut down the use of cell phones, although in China, a cell phone is virtually mandatory as a way of tracking and controlling the people there. Nevertheless, it was very suspicious and it caused for concern. And I mean, 21 million people to have died seems pretty extreme and seems unlikely. Nevertheless, it does seem like we're not getting a full picture, right? And whenever you're not getting the full picture, I think you have to look a little deeper. So what are we seeing here? A stack of urns at a funeral home in Wuhan, there's Wuhan again, the city's official cremation rates and reports of an overwhelmed healthcare system have prompted speculation that Wuhan's real COVID-19 death toll could be in the tens of thousands, despite the Chinese government reporting 2,535 deaths from just over 50,000 coronavirus infections. And that's in Wuhan. I think there's another 800. So in a country of 1.4 billion, their death toll is like a third of what Italy's was. And Italy has maybe 55 million people. The coronavirus outbreak was first identified in Wuhan, Hubei, in December 2019, before it then spread around the world, killing more than 33,000 globally as of Sunday. That's up to 36 now. China's aggressive containment methods have slowed the virus domestically, with official new cases reported plummeting in the past few weeks. So far, Beijing has confirmed roughly 81,000 cases and 3,300 deaths, mostly in Wuhan, the epicenter of the virus outbreak. But many people accuse, including US politicians, have accused China of underplaying their real coronavirus death figure. And I'm not accusing them yet, but I am skeptical, right? I am very skeptical that we're not getting the facts. And while we're on it, there's a lot of reasons to be very skeptical and to determine that we might not be getting the full picture. Like, for the amount of people that have died from this, let's just deal with Canada. More people commit suicide each month than have died from Wuhan, right? There's probably more I'll look into this, but traffic deaths, drug overdoses, all this stuff would probably be more. But we're not shutting down everything from this. So either A, we have an extreme overreaction, or B, we're not getting the full story on the seriousness of this. I don't know. I don't think any of us really know. But you know what, man? We're gonna piece together these puzzles, right? In 2019, Wuhan saw 56,000 cremations, a figure that was 1,500 higher than in 2018, and 2,200 more than in 2017. The population grew by only 1.1% from 2018. These figures are suggestive of an increase in the city's death rate above the population growth rate. They're not conclusive. So, some Wuhan residents estimate that the coronavirus death toll could be 26,000, based on the amount of urns being delivered and distributed across the city. Citizens on Chinese social media have said that 7 Wuhan funeral homes will likely distribute 3,500 urns per day on average from March 23rd to April 4th, which marks Qingming, the traditional tomb sweeping festival. By that estimate, 42,000 urns would be given out in the 12-day period. By subtracting the expected deaths of roughly 16,000 in Wuhan based on China's annual death rate over 2.5 months, they estimate that the urns show that the coronavirus outbreak could have resulted in approximately 26,000 deaths. It is currently unclear, however, how many of the urns have been used. Yeah, 26,000 deaths. I would have no trouble believing that at all. I mean, Italy is at half that right now, right? So, okay. So finally, and this comes from Dwayne Knutson. This is a Chinese billionaire. Let's see. We don't know his name. Now, I do think that this guy may be exaggerating and maybe blowing things out of proportion. And maybe he has some sort of beef with the government. I don't know. But let's listen to what he says.
接了一个来自武汉战友的电话，他告诉我什么？移动式火化炉是他和他别人亲手管理和对接的，是他告诉我说，这个移动焚化炉大家一定查查是哪生产的啊？我先不说，你们查查中国是哪个厂子是移动焚化炉生产的？移动焚化炉从 SARS 就有这个。
Okay, so what he's saying is through his business contacts, he has a contact in China that's tracking the mobile incinerators. They use mobile incinerators because when people die of infectious diseases, they can't bury them and they can't use standard cremation practices because there's just too much transport of the body involved. So they use mobile incinerators. They've been doing this since the SARS outbreak.
火葬场移动式的火葬场就是一个移动的火葬场可以5吨，5吨大概多少人呢？30个人一天，烧掉30个人。现在公开是40个送到了武汉，40乘以30啊，那就是1200，是吧？就1200。那么这是放哪呢？ 就是那个所谓的新仓医院啊，雷神山医院。这个东西往这个医院下边的门挖个洞一怼，往那一怼，就像那个大货车往过卸货一样，一怼，楼上的人死了，直接从上面扔下来，吧唧啊，扔下来，然后呢一个抓钩把他拉进去，这个人 biu 就没了啊 ，biu 就没了。这位战友说他不是送了40个，全国已经有40万个在分发，说现在要下100万，马上生产的量，100万个移动式火葬场。一个就乘以30，多少？3000万，一天就给你可以烧掉你3000万人，就烧掉2个女，战友们，你瘆得慌吗？你害怕吗？你从前线进去的人前一批全是死了出来的，3000个护士医生感染，仅武汉，你还相信那2000个的数字吗？2000个人，他会给你准备40个移动火化炉吗？
Okay, so I'll leave it there. He's talking about, up to 30 million dead bodies all across China that are sort of being covered up and pushed into these mobile incinerators. And that does seem a little extreme. That seems overblown to me. And he's just going on hearsay. But it does make the official count of 3,300 seem, it's starting to look ridiculous, to be honest. And all the dissident voices that are coming out of China, they're all saying this is worse than you're being told. None of them, and I mean, they don't really have any motivation to lie, right? Like, I mean, if they're going against their government, it creates more problems for them. But none of them are coming out and saying, yeah, it's really not that bad. I think things were handled pretty reasonably and it's not that bad. And, I mean, we know that the Chinese government, they were welding doors shut in buildings, right? And you wouldn't do that if something was basically a severe flu, right? Like, I mean, obviously it had to put the fear of Buddha in them or the fear of Jupiter in them, right? So there you go. I think that's our deep dive on China. Is China lying? Yeah, I'm going to say yeah. And we don't know exactly what they're lying about, and we don't know to what degree they're lying. But we have enough suspicion that I think that we can start calling it out. There's a lot of inconsistencies. There's too many coincidences, and they're starting to paint an unpleasant picture for China. Okay. So keep that in mind. That is the kind of day it's been today, March 31st, 2020. I am your faithful host, Rick Richards. Remember, I have maybe one more day of this. If you guys would like to see me keep doing videos, then give me a thumbs up, hit subscribe, tell me you'd like to see me do some other different things maybe. And maybe I will. Maybe I'll do that, right? If you want me to keep going, I'll keep going. But as for the COVID-19, I think we're about 2 weeks away from the peak here in British Columbia, and then we should be able to start riding it out. But we'll get into those details later, okay? So remember, if we are all together, can't nobody stand against us. I will see you tomorrow.